All right, today we're going to take a deep dive inside the body's hidden highway system, its arteries. We're going to follow the flow of blood from the heart's main superhighway all the way out to the tiniest backroads in your limbs.
So just imagine for a second. Think about the highways that deliver all the essential fuel and supplies to every single city and town. Now, what do you think happens when those highways get blocked up or narrowed or just start to break down completely?
Well, that is the critical question we are exploring today. We're going to follow that path of blood right from the aorta, which is the body's main artery, all the way down to the tiny vessels in our limbs, just to understand what happens when that vital flow gets compromised. So our journey starts at the very source.
Our story really begins right at the source, the aorta. This thing is the largest artery in the entire body, and it comes directly out of the heart. But, it's not invincible. It can actually become inflamed, a condition we call aortitis.
Now, what's so fascinating here is that aortitis isn't just one single thing. This table shows us three main causes. First up, you have rheumatic aortitis. This is where the body's own immune system gets confused and mistakenly attacks the aorta. Next is idiopathic, which is kind of a medical mystery. The aorta's wall just thickens up, and we don't fully understand why. And finally, there's infective aortitis, which is pretty much exactly what it sounds like, a direct bacterial invasion from nasty pathogens like staphylococcus.
So all of this inflammation can seriously weaken the aorta's wall, causing it to bulge outwards in a really dangerous way. This bulge, we call it an aneurysm. And as you can see here, they can form in different shapes. Infective aortitis, for instance, often creates what's called a saccular, or kind of bubble-like aneurysm. Other conditions can cause a more uniform, spindle-shaped swelling, which is known as a fusiform aneurysm. Okay, now let's follow that arterial highway a little further away from the heart, out to that huge network of arteries in our arms and legs. This is where we run into a much more common problem, peripheral artery disease, or you'll hear it called PAD. So what exactly is PAD? Well, at its core, it's really a plumbing problem. There's this thing called atherosclerosis, which is just the buildup of fatty plaques, and it causes a narrowing, or stenosis, and eventually a complete blockage, or occlusion, in the arteries that are supposed to be supplying blood to your limbs. And what's causing this big plumbing problem? Well, the risk factors are probably going to sound pretty familiar. Cigarette smoking is a huge one. So are diabetes, high cholesterol, and of course high blood pressure. These are really the key culprits behind that plaque buildup we were just talking about.
So where do these blockages usually happen? This chart makes it really clear. The overwhelming majority, we're talking 80 to 90% of cases, involve the femoral and popliteal arteries, which are in the thigh and behind the knee. The lower leg arteries are next, then the lower aorta and iliac arteries down in the pelvis. The legs, they are truly the primary battleground for PAD.
Okay, so now that we know what the problem is, let's talk about how it actually feels. How does your body tell you that its fuel lines are starting to get clogged up? Well, the classic warning sign has a very specific name, claudication. So let's really think about that for a second. If the arteries in your legs are narrowed, what would you expect to feel? Especially when you need more blood flow, like when you're out for a walk? That feeling is called intermittent claudication. It's a very distinct pain, an ache, or maybe a deep fatigue in your muscles, usually your calves, that predictably shows up when you walk, and then it just disappears when you stop. The analogy is perfect. It's like a fuel line that can't supply enough gas to an engine that's trying to go uphill. The engine just sputters until you ease off the accelerator. But here's the thing. If you don't address it, the problem gets worse. The narrowing progresses from just causing pain with exercise to causing pain even when you're resting. That's called critical limb ischemia. At this stage, the tissues aren't even getting enough blood to survive their basic needs. And the final, absolutely devastating step is tissue loss, where ulcers form and gangrene can set in. So how do doctors go from a patient just saying their leg hurts to an actual objective diagnosis? Well, fortunately, there's a really simple non-invasive test that gives a very, very clear answer. It all comes down to this one number, less than 0.90. This is the result from something called the ankle brachial index, or ABI. It's a simple ratio that just compares the blood pressure at your ankle to the pressure in your arm. And if that pressure in your ankle is less than 90% of what it is in your arm, well, that's a crystal clear indicator of a blockage. This simple ratio, it tells a really powerful and incredibly important story. And this table here really puts that number into context. A normal ABI is somewhere between 1.0 and 1.4.
A little bit below that, from 0.91 to 0.99, that's considered borderline. But anything below 0.90 is a definitive diagnosis of PAD. And interestingly, a really high number, something above 1.4, can also be a problem. It suggests the arteries are calcified and can't be compressed properly.
Okay, now we come to what is probably the most critical takeaway of this entire explainer. Peripheral artery disease. It isn't just a problem in your legs. It's a system-wide warning light. Just look at this statistic. A 15 to 25% mortality rate within 5 years for people with symptomatic PAD. I mean, that is a shockingly high number. It's actually higher than many types of cancer. And it really begs the question, why? This quote from the source material gives us the answer, loud and clear. That high death rate? It isn't usually from the leg problem itself. It's because the same gunk, the atherosclerosis, that's clogging the arteries in the legs, is almost certainly doing the exact same thing in the arteries of the heart and the brain. So, at the end of the day, that pain in your calf is basically your body's check engine light coming on. It is a critical early warning that the exact same disease process is likely happening in the arteries that supply your heart and your brain, putting you at a much higher risk for heart attacks and strokes. And that leaves us with one final powerful question to think about. PAD really forces us to see the body not as a collection of separate parts, but as one single interconnected system. And a problem way out in the periphery could very well be a message coming straight from the core.